about school services. And, um, whoop, and we're going to talk about some of the federal language and laws that led to the services being created, and really to understand what terms mean, specifically what a 504 plan is, what an individualized education plan is, and some of the legal language that created these programs, as well as recognizing that there are other school services by state. And I'm going to focus on the ones in West Virginia, but if you aren't from West Virginia, there may be other names and terms that are more school-based programming, but the 504 plans and the IEPs are rooted in federal law. And it's helpful to understand what the law is and know the words, because as a clinician, and this is my disclaimer, I am not an educator. I don't claim to be a lawyer. I come to you as a clinical consultant in how I share my knowledge about how mental health in pediatrics may impact schooling, and knowing my role in that as I present my information to schools. I don't claim to know how to educate people. I don't claim to know how to help people read, but I do understand how mental health might impact the learning process. And this helps me communicate as well to schools what they need to know about mental health and how it might be impacting that student, and things that they can do to support this child medically or psychiatrically for the best learning outcomes. And so a lot of this is about communicating and understanding different worlds. And I'll give you lots of examples, hopefully throughout that, at how you as a clinician might be able to word things or support things. But I certainly do always ask, if you are an educator or more involved directly in this process, please make sure if there's something I say that isn't helpful, to let me know. A lot of school folks have said, we love the way you approach this, do more of it. So, this is really about bringing in school into the team of care for children for me. All right, so why is it important for pediatric mental health and clinicians to know about schools? Well, only about 1 in 5 young people right now are getting treatment for mental health, and yet 95% of kids go to school. So there are a lot of unmet needs in our society, and school is often the place and time where lots of things might first surface. And as we evolve into more treatment modalities, more and more kids are maybe getting services for mental health in school, or accommodations for those things, which is a good thing. A lot of the legal framework for some of the policies that are there really does take root in the 14th Amendment. And this is really that idea that everyone has a right to education, and that we have to have equity in the delivery of those services. And this really branched off into disabilities and mental health and medical care to make sure that children with a physical health diagnosis, a mental health diagnosis, an intellectual disability, or some type of other need still was receiving services. Before this law, people were kicked out of school. They didn't have equal rights to education, and they didn't have to be educated. And they were not even allowed to go to school. And so this really became the foundation of a lot of the basis of this. These are the 3 key federal laws that exist, and I'm not going to go into all of them. I do want to point out that the 504 plan that you'll hear about in schools comes directly from Section 504 of the Rehabilitation Act. That's where the term comes from. So it's actually a 504 plan that we're going to talk about is actually coming directly from this law and its terminology. And the Individual with Disabilities Act was really focused on, again, this idea of broad education. But the Americans with Disability Act expanded disability needs beyond just school as well. So this became beyond just school with the American Disabilities Act into the workforce and other things. But all 3 of these impact laws about school. And a key really part of that is not just education access for all, but it really is to make sure it's the least restrictive environment. And that's important to understand. If you have a child that's really struggling, there can be a lot of wants to isolate the child, give them all this one-to-one attention, or, remove them from the group. And while that can be may be helpful is actually pretty harmful to exclude kids from group-based learning, and creating normalcy and heterogeneity in education is actually healthy for all kids. And so the law really says if a child needs services that a normal kid doesn't, or they need to be put in a different type of placement, you have to really justify that you're still showing the least restrictive level. And that's a when we talk about placements within education, whether you're in a special ed classroom, a general education classroom, if you need a specialized school, there really has to be substantial thought given to why can't we mainstream them. And that is because mainstreaming has mental health benefits and actually educational benefits for students, probably that exceeds that restriction in many studies. And so it really is something to be aware of. And it doesn't mean less services, but it's sometimes something we have to explain to parents so that they understand what that term means. So the term 504 plans, again, come from this equal access to education. And the buzzword I want you to remember from 504 plans is accommodations. A 504 plan allows the child to get things that help them learn, but here's the key. They get assistance and accommodations to learn in a normal environment. This is not changing the child's educational curriculum. If a child has needs for test or education at a lower cognitive level, or even like gifted at a higher cognitive level, that's not 504. That's not accommodations. That's a difference of need. 504 is just something we give you to help. If you don't have fingers, we give you a tablet where you can use your elbow to write. It does not mean we changed your curriculum. We're still going to give you the same subject matter, same grade level, on level work, but we're giving you services to help you. If you're blind, we'll give you your books in Braille, but they'll be the same books that the other kids have. Okay, so 504 plan is accommodations that you need to be successful. And we're going to translate to what accommodations might help a child with a mental health disorder to be successful. But it really is about what kind of things can the school do to help that child do their best at that educational level of their age. Okay, when you talk about needs outside of a normal curriculum, like you're changing the curriculum, that's where 504 no longer exists. And we move into the term individual education plan, or IEP. So 504 plan, accommodation. That's the part I want you to remember. Okay. So in order to understand what a 504 plan is, you have to know what a disability is. And so the legal definition of a disability is anyone that has a physical or mental impairment that limits life activities. And so pretty much any physical diagnosis or mental health diagnosis may potentially meet this. And we're going to talk about what a major life activity is in a minute, but our mental health diagnoses may meet some of these needs, even at the 504 plan level. And so often we are explaining how our mental health diagnoses, and you can do this for physical health too, but in my case, it was mental health, how this mental health diagnosis might impair their learning, or and I might need to make recommendations for the school to help assist the child to be at their best at their curriculum with those accommodations. So I do have a role at suggesting maybe accommodations that will help my patient with their diagnosis. Okay, so it's just about these accommodations to give access to the same opportunities as their peers. Okay, so this is that very long definition that just about anything could potentially be a physical or a mental impairment in medicine. So what's the definition of a major life activity? Again, this can cover anything from eating, sleeping, walking, talking, communicating. And so if you think about, when we talk about mental health disorders, what are things that can be affected by a mental health? Well, alertness, attention, being able to sit still for long periods of time, their social communications and engagement with things, all of those are major life activities. And so often we're explaining how those things might impact and affect the school. It's also really important to separate out this idea of grades equal disabilities, and a lot of this acts really to emphasize that just because you are doing well does not mean you're impaired, or just because you're doing well does not mean you don't need accommodations. Many people make their own life hacks or accommodations, or the parents going above and beyond to make the accommodations. So it is not the same to just say they make good grades so they don't need services. And there's a critical part in this that says that is simply not true. We're not making accommodations for grades. We're making accommodations for physical, mental health needs. So the school has teams, and the 504 team is not as specific as the IEP team is, but it can include a lot of different people. It could be the student, it could be the data, it could be a letter from a provider, or the provider can go, parents can go. There's not a standard write-up or plan, but they do create a written document that should be available if a child has a 504 plan, and it just says, this is the child's diagnosis that meets the category of disabilities, and these are the accommodations that this child is allowed to have. And they will write this up as a team, and it is a federal document that can follow the child forward. It's much shorter than an IEP, and it may look different from state to state, but it is an official document. So as a child analysis psychiatrist, what do you think the most common reason a child might need a 504 plan is? Anybody from the audience? I can't see the chat, so.
I'll monitor the chat for you. And everyone's welcome to unmute as well.
Guesses? All right, I won't make you. It's ADHD, okay? ADHD is one of the most common needs for a 504 plan. And so if we think about the definition, ADHD is a medical diagnosis. What life activity is impaired by ADHD is attention, concentration, sometimes communication, because there's impulse control problem sitting still. So it meets the definition, and oftentimes we may need to make accommodations. So you will see a list of some accommodations that might be helpful to kids. Now, I will say that not all these things help all kids. A really good plan is to sit down with the family and the child and say, you know, what kind of things would help you be successful, and not give them all of them, but be like, which ones of these would be most helpful, and which ones do you want to start with to see if they really do help. Again, this does not change the assignments, right? Or the curriculum. They would still be doing multiplication tables in 3rd grade like every other child. We're not saying they can't do the work. We're providing assistance so they can be maximized in their success, okay? But this is a common list of ADHD modifications. Okay. Then we move into understanding what the Individuals with Disabilities Education Act is, and they get a little bit more specific under what category a plan would be. And these are the categories that actually are on the IEP form. So you have to show that you fall into one of those. And so they do tend to use these for the 504 plans as well, but they are critical for the IEPs. Things like ADHD is going to fall under the category of other health impairment, okay? You will see, however, that there are many other categories that psychiatric and mental health diagnosis may also qualify for. So a serious emotional disturbance, or things like psychosis, mood problems, depression, anxiety, bipolar disorder, learning differences could fall under learning disorders, intellectual disabilities, or any child with an intellectual IQ delay, traumatic brain injury, a diagnosis of autism. Developmental delays with being behind in speech and language are also part of what categories can qualify for moving on to that IEP or to get a 504 plan. And so if the school does need verification of their diagnoses. So sometimes my role as a provider is to provide the diagnosis so that it justifies the service. Other times my role as a provider is to make suggestions that could be helpful based on my understanding of their presentation. But sometimes the school reaches out to providers. They're like, why is the school reaching out to me? Because they actually need this information so that they craft the plan well. And so if you do get a request for school, they may just be looking for confirmation so that they can help the child's plan. And so it's important that we communicate that back as well. Also, if you know that a child has a 504 or an IEP, I would always urge you to get a copy because you might not know what it's for. And one of the examples I give is if a child's ever had a speech delay, maybe from a kindergarten screener and they need to get speech, they'll have an IEP for that. You may think that if the parent may think they have an IEP, they're getting all kinds of other services, but even if they're just getting extra speech services, they have an IEP. And so if the families don't often know what their IEPs and 504 plans are, and so if they don't know, get a copy. Sometimes our role is really just to help them explain it and understand it. When we move to the IEPs, these documents get really big and are pretty confusing. And sometimes I'm just explaining it to people that really helps them understand. So as we go through these categories, we want to make sure we understand what the definitions of each of these are. This is the emotional disturbance one. These are, again, characteristics that over an extended period of time is somehow presenting with a symptom that impacts educational performance. So it's not an inability to learn, it's not an intellectual factor, it's a health factor. That can be things like inability to maintain interpersonal relationships. So kids that are having social problems with their peers and teachers may meet this definition. Inappropriate types of behavior, this might be aggression or reactive behaviors from trauma, that may fit. Mood disorders, unhappiness, depression, or severe fears, anxiety disorders. And so sometimes when you write that, you have to explain, and you can use this language, this is the language from the code, why they meet. And so I never say you have to give the child an IEP, but I might write a letter to the school. This child has serious depression. It significantly impacts their ability to maintain relationships with peers and teachers at low points. It challenges their attention and focus. Sometimes they have lots of physical symptoms related to their anxiety that could interfere with their learning. Could you consider, or would you consider developing an educational plan under the category of emotional disturbance for their diagnosis of major depression they may benefit from? And then I might suggest therapeutic things that could be accommodations or helpful to them. And so you can use the language of the code to help articulate the request. And I will tell you, I love school teachers. I have called school teachers. I've said these things. They love to hear those things from us because they want the child to be successful. And sometimes I just got to call someone up and be like, who should I talk to? And they're like, yes, can you put that in writing? And I've 99.9% of the time, and I've picked up the phone and began a conversation with the school, it has always had a positive outcome for the student and the school. So this was a role I didn't understand until I started doing this. And so you have a huge role to play in maybe helping these kids. Other health impairment, remember I said that's where ADHD falls. Other health impairment is any medical or health problem that affects alertness. So that could be ADHD, that could be a sleep disorder, narcolepsy, or some other condition might fall under this category if it doesn't meet others. And this is again an example of the type of letter I write that would say, you know, this person's been a patient of mine, I've diagnosed them with this, it may impact school because of this. Could you consider these things to help the school? Sometimes when I'm not sure what's going on, I might need the help of the school. So for things like aggression or learning problems or behavior problems, I might ask the school to help me. And so for disruptive behaviors, I might write, I'm concerned that this disruptive behavior, this aggression, may be coming from their anxiety or maybe coming from their depression or untreated ADHD. Could you help me with a functional behavioral analysis, or could we consider putting together a behavioral intervention plan at the school so that we can address that need while still making sure their educational goals are there? So, but the families and the children do need some verification of that diagnosis from us. The school cannot give them an ADHD diagnosis. The school cannot give them a depression diagnosis. They can suspect it, but that may fall on us to do that as well. So in order to move that process to an IEP, there's actually a very complicated, lots of step process to get that to happen. The first is recognizing the need. And so any provider, teacher, many times the school does it themselves, makes the suggestion that, we might need to have an eligibility meeting. There's a concern that a doctor or a provider or another teacher has had that maybe this child needs a change in their curriculum or services outside of normal. Because remember, IEP means you're going to have a change in your curriculum. And so they may identify a child, they'll have an eligibility meeting, and these eligibility meetings have to include the parent. It usually has to include a general education provider, a special education provider. If there's been past testing or other resources, they'll bring them in and they'll look at it. If they don't have enough information, the eligibility meeting will say, okay, there's enough reason to suspect that we might need this, but we need to go get that doctor's note. We might need to do testing. We might need occupational therapy or speech evaluation to know. So the eligibility team will meet, review it, and then they will meet again to have like a determination meeting. And it's only after the eligibility meeting do they then decide, okay, this child needs an IEP, this child needs a 504 plan, or maybe this child doesn't need those services. Maybe it's already resolved. And so there's this multi-step process before that IEP is generated. Once you get an IEP, it's a very thick document, has lots of pages. We can talk about what's in it. I would advise you to look at it. They're really intimidating the first few times, but once you get comfortable with it, they're all the same. You can figure out right where to go. Sometimes they can also be really helpful to me as a clinician when I'm assessing mental health things, especially like ADHD. Sometimes the kid has the IEP. I get the IEP, and all over the IEP is they've already done the Connor scale, or they've already documented the level of hyperactivity through BAST or something like that. The school psychologist may have already done testing. It's all right there. And so IEPs can be tremendously helpful to me as well if I know a kid has one for clinical symptoms. But that IEP, once it's generated, will be reviewed annually. So there'll be an annual meeting to look at the IEP. And then every 3 years, they're supposed to completely reassess if the child still needs the IEP or changes need to be made to the IEP. There also may be times when there's an earlier meeting called to relook at the IEP if a new event occurs or progress is not being made. So these are all the people that can be part of an IEP. Usually it's the parents, caregivers, and the first page of the IEP, you have to sign it. You have all these signatures of who attended and who they represented, because by law, they have to have different, it's multidisciplinary, and they have to have different teachers, different administrators, and people there. It's important to recognize if you ever attend an IEP meeting as a provider, you're a guest of the family. You're not a guest of the school necessarily, unless you're employed by the school through a different means, but you usually are a guest of the family in that regard. And they have to go through a lot of steps to, again, assure that and you'll see that on the IEP where they have to mark certain boxes or prove that they considered least restrictive methods. So there's a lot of steps. Things that you can do to be really helpful to the school, again, is, again, if you get records requests, try to be helpful. I don't like to release the entire medical record to the school because sometimes I do think there's sensitive information in there, but I usually write a letter, even a brief letter, and I usually write it with the family there, and I hand it to them during the appointment so that they can see the note. And for a lot of families, that letter that I write is like their little ticket to start the conversation or sort of motivate them to be engaged with the school too. I don't drive it. I try to facilitate it. And also, I don't always know what the school needs. And so sometimes if I'm not sure what the school needs and I don't think the letter's enough, I'll usually call the school with the family in my office. Now, there are really a lot of privacy issues with school. We have HIPAA, they have FERPA. So you need a lot of paperwork to send letters or get records if the family doesn't bring them to you. So actually, by virtue of handing the letter to the parent, I don't have to worry about HIPAA. I'm handing the letter to the parent to give to the school. I think that includes them in the process, but it also prevents needing 500 pages of notes. The school can't send you an IEP without another separate note from the parents, but the school does give the parent the IEP copy. So sometimes I think engagement of family really helps with getting the paperwork to go through, but it also, I think, helps the family be more of the process and be included. So it's not being done to the child, but with them. But you absolutely can attend a meeting. I have attended many meetings. I've always felt welcome, but I'm always a guest of the parent. I don't drive it. I wait for my turn to answer questions that they might have, and I continue to be available to them after the IEP is created, because often I'm tracking progress, whether their ADHD symptoms are getting better, whether their depression's getting better, and how it's impacting school. The actual IEP document is very overwhelming, but it has all these little, I've seen IEPs be 20 pages long. They will list all these things. And this is where you can also find a lot of assessments that's been done. The child may have already had IQ testing or occupational testing. They may be getting transition services. There may be things in there about what their educational benchmarks are and achievement testing, their yearly testing that they did and where they were falling. It may have reports from an occupational therapist or the school audiologist or the speech. There can be a lot of clinical assessments that are in there. And as I said, a lot of times I'll have a kid that never saw a mental health provider that had untreated ADHD, and the parent will come for their first appointment with me with the IEP. And I'll go right to some of the current present level of educational performance or behavioral observations in the IEP, and there'll be 3 years of uncontrolled hyperactivity and a behavior plan that look great, but the child still couldn't sit still or focus. And right there's a lot of clinical information from the school that sometimes means I don't have to send an additional rating scale or make an additional phone call. Or sometimes right there in the IEP is the testing results that already suggest that there might be some concern. So I think I find IEPs very helpful to me as a clinician as well. So again, step by step, there's usually a child's identified, a written request is made, and you can make a written request. You can also encourage the parent to make a written request, why they think an educational assessment or meeting might happen. The school will then call this eligibility meeting. It's important to note that the school, again, has all these laws that they have to assure they have met and looked at, and they do have a responsibility to find children with disabilities that might need help. But it really is ultimately up to the school process. You can't, if the school in good faith went through a process and doesn't feel like the child needs that service, you can question the process, but they have pretty high standards for that. And oftentimes I think when I've seen a child not get services, it's because they didn't get enough information. I don't think they did things wrong, but I have seen kids not get the services they need because they didn't get the doctor's note, or they didn't get some critical piece of information. And sometimes the families didn't want to share it either, which I think is always a challenge. I don't want the school to know that my child had autism. Okay, but we can't give your student access to those services if we don't go through this process, and helping families kind of weigh that can be challenging. And just because you have a diagnosis also doesn't mean you'll get those services. Again, we have to show that's impacting their education. We have to show that it's impacting their activities of daily living. A diagnosis alone doesn't meet that criteria. You have to show that functional part. So then when that eligibility meeting, that first identification occurs, there's usually about a 60 to 90 business day period, several months, where they're going through the evaluation. Once the evaluation is completed, and that may include this record collecting, getting testing, then this eligibility meeting will happen. And in that meeting, which is usually the second meeting, again, all the findings and reports and notes and things that they were trying to do, maybe they were getting extra behavioral information, they'll meet and say, yes, we have all this data. We believe they do need an IEP. And now the next step is crafting what that plan looks like. What classroom setting do they need? What curriculum do they need? Do they just need services for math, or do they need services across all their subjects? does this impact their specials and their recreation? Do they need school-based therapy? Do they just need to go to the nurse's office to get their insulin? It could be a whole host of things. So they're going to look at all those factors to decide what those, again, it's individualized. What are the specific needs of that child? And then they'll write the plan. And it is the writing out of the plan, which is your sort of path forward. And then every quarter, the same way they, or trimester, depending on when they do grades, they also reevaluate progress for the IEP. So parents will often get like a progress update on their IEPs if the kid is meeting the goals or not. And then that whole plan gets reviewed annually to see if they're still making progress. One of the things, of course, in mental health that we also see is understanding the role of disruptive behaviors and disabilities. And this is something that was probably my predominant role. A lot of times disabled children or children with medical or psychiatric disorders will have disruptive behaviors. And it's really important that we understand if that disruptive behavior was from their disability, because by law, if their disruptive behavior was from their disability, what should happen is a change in their IEPs or services, not an expulsion. So if a kid has a trauma response and has a tantrum, or maybe swings their arm and hits something because of a flashback because they have really severe PTSD, technically that does not mean it was a purposeful behavior to hurt somebody. It was a result of their disability. And so if that occurs, they're supposed to do something called a manifest determination review to decide if that behavior was the result of the disability or not. If it was the result of the disability, then they're supposed to revisit the IEP. They are not supposed to expel the child. I've seen a lot of kids expelled for disruptive behaviors from untreated mental health. And if they didn't know there was a mental health condition, they may not realize that it was from it. And so this has been the other role in mental health that I've had to explain sometimes is, was that disruptive behavior on purpose? Were they trying to hurt somebody? Were they, trying to, I would say more times than not, that's not the case, but some of these behaviors are really, really huge. And so unless they're selling drugs on school or bringing weapons to the school, this is the process that a disruptive behavior is supposed to go through. And so if you do those things like sell drugs or like threaten someone with a weapon, that's a different type of process. That's sort of the exclusion to the manifest determination. But kids that have maybe recurrent tantrums or recurrent aggression or cussing or something like that, that really needs reassessed under this process. And I've had to ask for this before. I've had to say, I really think you need to consider that this behavior may have been from. This was a big issue when people had trouble getting their stimulants. I had a lot of kids who ran out of stimulants, who couldn't get their ADHD medicine, and they did something impulsive or slightly aggressive in school off of medicine. And I had to write, I think this behavior was the result of the stimulant shortage. This child has far better control of themselves when on stimulant medication. This is a real problem. Could we re-review that behavior as untreated ADHD as manifest determination instead of a purposeful behavior? And again, schools are very, very willing to do that, but they don't know. And so that again is the role as a clinician of a way to kind of communicate that and use the right language that the school needs to hear to move it forward. One of the things that I also know about schools is there's lots and lots of acronyms. Here are some that are pretty common, and these are things that can be really helpful. Behavior intervention plans, positive behavioral support, functional behavioral analysis, extended school year, and TAG, talented and gifted, are frequent in these things. If you hear an abbreviation, you don't know what it is, ask. But it is very overwhelming to go to your first IEP meeting when it sounds like everything is alphabet soup. So I spent a lot of time talking to families about what those mean too. So this is a little bit with the American with Disabilities Act, and this actually does apply to schools, where the 504 and the IEP really only exists in public schools. You can't get an IEP in a private school. And I think it's important to know that. The American with Disabilities Act actually is a separate thing. And so when kids go off to college or workplace, or even in religious affiliations, there still are some protections with the American with Disabilities Act, but they're not the same as the IEP. It just prevents discrimination, not extending the details of the IEP, which I think is important to understand. So those were the federal things that we talked about. I'm just going to briefly share that there are other things in West Virginia at the state level that can be a type of service. The 504 and the IEP, again, are sort of federal programs. In West Virginia, we have 3 other levels of kind of plan. The student assistant team is designed to be a more early intervention that can meet more often, usually monthly, to help meet the needs of a child. This can be really helpful if there's an acute issue. Maybe there's a loss, or a parent died. It hasn't advanced to a full chronic diagnosis, but maybe a child's coming back from the hospital. They need faster interventions and faster services to get back on track, but there's no evidence of that chronic impairment that would suggest they're going to need the IEP, but they need help. And so the student assistant team was designed to be fast and quick and kind of get services in place faster. And in West Virginia, this can really be used for things like bullying or a school event that might have been quite distressing, that kind of needs immediate recognition by the school so that it doesn't become bigger. But that's a state specific term. There are other things like a multi-tiered systems of support, and then individual healthcare plans are part of the state language for kids that may need more medical assistance for like diabetes or seizures or some type of medical interventions at school. And so here's sort of the list of hierarchies from fastest to the most federal in terms of the IEPs, in terms of the hierarchy of options. This is the state code regarding student assistant teams. You can take a student assistant team and move it to a 504 and IEP down the road, but these are designed to quickly address needs for academic or behavioral support for students. So they're supposed to respond within 10 days, which is much faster than that IEP process. SAT teams kind of function like 504 plans. They're just meant to quickly bring together the key players to get some things in place. But if a child has a 504 plan or IEP, it kind of does trump the SAT team. It's the get your foot in the door process. So a student does not need both. You do not need both an IEP and a 504 plan. In fact, you cannot have both, right? A 504 plan is only accommodations, and IEP means you need a change in your curriculum. So it's important to not use them interchangeably. And so again, I think about things that I have needed to request SAT or 504 in the past, not IEPs, but acute events that my students might really, or my patients might really need some assistance with. A kid that's having really severe anxiety or panic attacks. I'm maybe in the midst of changing medications, but that panic attack is making them miss school, or they're having some grief or depressive episodes that's sort of short term, affecting their attention and focus. Maybe they're having a bullying issue. And these can be simple interventions. I mean, I've written letters that said, this child is having specific problems with this child and is already struggling with this. Is there any way we could move the child's seat to a different place or move them to a different classroom? It doesn't have to be a huge intervention, but that's an easy intervention that the child or the family may not have taken to the school. The family could ask the school, but again, sometimes they're asking for your support and those suggestions. I have some kids that may struggle with going to school. You're trying to just get them back to school, and they may need help to get through the door. Maybe they lost a loved one. Maybe they're having some social skills problems. I've had patients with what used to be called pseudo seizures, functional neurologic symptoms, where they're having physical symptoms that are probably secondary to mental health. All of those things could help them get better. Bullying is a big issue. I'm not going to go into that, but the SAT process and schools were really looking to minimize the effects of bullying on education. So that is definitely something that the school wants to know and know how to intervene. And I've had a lot of success with helping communicate that with practical solutions. I'm not going to go through this just in the interest of time. This again sort of talks about, what can you do from the standpoint of a clinician? Always get a copy, help the family understand the copy. And if you can get out of all the paperwork of faxing the releases and getting things signed, you can have the parents bring the copy to you, and you can give your letter to them to give to the school and empower them in that process. You can explain to them what the IEP says. I have had some parents be like, I'm not sure the school is doing anything. And I've gotten a copy of the IEP, and maybe the parent didn't even know what the school is doing. And then sometimes they're like, oh, maybe that's why school's going better than home. And sometimes the parent can learn from the structure of the school. And so it can be a very therapeutic process to also help the family feel like they're part of the team. And I think often looking at an IEP can be really helpful for that community of support for kids. And sometimes literally during my medication appointments, I have literally just explained the IEP to the parent. And that can be really helpful, because it is, even as a professional who knew these things, my first IEP meeting sincerely was so overwhelming. It is really confusing. My own kids have IEPs, and I, if I had not known what I knew, I would have been overwhelmed. They're complicated. Get releases when you need releases. Don't send records without going through the family. And if you are sending your full record, make sure you're getting those releases. As it really helps, I think, to ask who the point person is at the school. I call schools a lot, and I gotta tell you, I've had teachers, I think, stop. I just wanted to leave a message, and the teacher will be like, no, they really want to talk to you. And the teacher will come answer the phone when that was not my intent. But if you know a name, and usually it's the vice principal, sometimes they actually have a point person for IEPs or the SAT team coordinator at the school. If you can get that person's name, you can get a name and get a contact going to reach out. And as I said, the schools love it when providers call, because they want to help these kids, and they may not know how to help a child, especially if it's with a mental health need. And so again, 99.5% of the time, it's been a positive experience. I do have some horror stories of it not going well, but they are few and far between, and far more positives than negatives in that regard. And so again, just a couple other resources just to make you aware of. There actually are practice parameters. If you want to be a school consultant, there's more information to families and providers about how to read an IEP and going through the details of those things. Again, I think it helps to practice, but I think my work with schools has been some of the most rewarding of my career in helping kids and families, and so I'm a huge fan. All right, I have a little bit of time left. What questions can I answer, or have you had good experiences with schools? I'm curious. I know several people out here do work with the schools, and I just wonder what your approach, your thoughts are about this. It's always, I've learned from others in this regard too. So
first and foremost, just want to thank you, Dr. Steiger. What an important topic, and the work that you do is just so incredible. So thank you. But yeah, any questions? Diana, I see you unmuted. Don't want to put you on the spot if that was actually.
No, I did have a question. I worked for a case management unit for years, and sometimes we'd actually have teachers bring students in for services, and we'd have to say, no, we can't provide that. And the teacher would say to us, okay, if they're not on medication, they're not going to be in my classroom. Is that legal? I mean, no. Okay.
no. Well, they may not be in that teacher's classroom. And I mean, I think that's, that's a whole other issue in terms of treatment. But, if the child has a condition that needs medication, and they, without medication, they can't function in the classroom, then the IEP may have to move them to another environment if being in that classroom is not safe for them or they're not learning in that environment. But it can't dictate, no school plan can dictate what the medical treatment is, but the school may have to make decisions on how to meet the children's needs. So, if you have a child with wild ADHD, right, running around hyperactive and can't focus, they're not going to learn in a environment. I know that's the teacher's reaction of disparity,
Mhm.
right, and frustration, but they would still need the IEP process to make that decision. For them, that one person cannot change that. I think that's the other part. No one voice can change the plan. It would have to take a medical doctor. It probably would have to take, the special ed, the principal, all these folks to decide about that. But you cannot require a child to take medications.
Well, you talked about the IEP and how involved the families were. What happens when the family is dead set against an IEP and the child is still acting up? The teacher can't do anything, the student isn't learning, and the parents aren't addressing it.
Well, I mean, that's a complicated thing too. I mean, my answer is get to the root of what the family understands, and often it's a lot of misunderstanding. I think ADHD is a really good example. I think, medicine treats very specific symptoms of ADHD, but medicine doesn't treat all symptoms of ADHD. And so it's a constant walk between what's a medication going to do, what's a therapeutic intervention going to do, what is medical, what does the school need to do. There's no expectation that I have the school's going to make a child focus or sit still with ADHD. The school can't do that. They can only provide accommodations. So I sometimes have real direct conversations with the family about that. There's nothing the school can do to make your child sit still or focus. They have this disorder. Try to educate what this disorder is, what treatment looks like. But ultimately, and this is a whole separate issue if we talked about anxiety and truancy, but not providing or not taking your child to medical appointments, not providing medical treatment to your child, not providing education is grounds for CPS referrals.
That's a good point. And some of our consumers that I worked with were already involved with CYS because of obvious reasons, but it was always the kids I was obviously most worried about because they don't have much input into their own lives, so.
I will say, and I don't know if you ever saw this, but I mean, I had some parents who I think just couldn't do it. And I had school nurses. And again, there were lots of papers and documents that made this happen. But we had some school nurses going to the pharmacy with the parent to pick up the medications, and the school was giving the medications, not because the parent didn't want to, but the parent really could not. And so we utilized a lot of those services with permission from the parent, sometimes to deliver medications. And communicate about that. And again, there's lots of steps and lots of, procedural things, because the nurse can't just go by herself to pick up the prescription, right? I mean, there's lots of steps in that, but I mean, there were times when it wasn't about the parents not wanting to, but really the parents' capacity was pretty limited. And often, and actually a lot of parents didn't even want to fight with their kids about it. And the kid never fought about taking it at school. So sometimes, again, when you dig in the weeds, sometimes the answer is not just, I refused. Well, it was too hard to give it in the morning. I was still sleeping because I worked the night shift. And so, I would always, so I want you to ask, what if your child just took the medicine at school and you just had to bring the bottle in once a month? Can we work on that? And then when the kid ran out of medicine, the nurse would call me and I'd make sure the prescription went back in. I know that that's a lot of steps, but I mean, sometimes, I think sometimes the power of the school, I was always surprised at the power of the school's willingness to really want to help these kids if we kind of came together and problem solved. And I heard more reason. I mean, there was never one reason, I guess. And I think each family just had very different individualized needs. It's hard to be global, but I saw lots of school systems go above and beyond for a lot of kids. And I mean, the families were very grateful for that too. But it's hard to just say that it's one thing. But I mean, right now, I mean, I especially after COVID, I mean, we've just seen an enormous increase of mental health needs in schools. And I think schools are just completely overwhelmed.
Can I say something too, just kind of to piggyback on that? I mean, I very much enjoyed this session. I come at this from a little bit of a different standpoint. I am a clinician. I'm also a parent of a special needs child. I've been and still am a substitute in public schools, so I've sort of seen it from all ends. And you know, I feel like, you know, it just sort of needs to be said, which I think all of us probably are aware of this, but schools are like everything else. It's a very broken system. And I'm glad to hear that you say that, you know, most of your experiences have been positive with the school system. I would say the exact opposite has been true for me as a parent. And I'm not the smartest parent in the world, but I feel like I'm highly educated and, you know, again, come from a mental health background. And it is a war. Every interaction with my child's school, and has been for the past 12 years. And so I feel like, kind of what you were saying earlier, a lot of parents, they don't know their rights. They don't know how to advocate for themselves. And the truth of the matter is even though my child and other children who have needs and special needs and all of that, they are entitled to things, that does not mean that the school system has to provide them. Legally, they should, they don't. And, you know, I've had to make state complaints successfully. You know, it just gets so ugly and overwhelming. So I think it's just a lot to expect any normal parent to understand the very complex system, you know, of IEPs and 504s. It's just a lot. And, you know, I wish that there would be, you know, in my dream world, I wish there would be an advocate at every school who could come alongside every parent, help them understand their rights, you know, because sadly, you know, a lot of schools are just doing the bare minimum to get by because they are understaffed. They don't have a lot of resources, and I get that. But it's kids like mine, though, that are often, they're not getting what they need. And there's nothing really that we can do about it. But I do think that, you know, it starts with education.
And Danielle, I agree with everything you say. I also would add, I think at least in this state, there's some pretty massive regional differences in school systems too. And I think that comes down to workforce and funding. Some counties have really put forth very big bond initiatives to expand those very things and add more special education or advocates, and they've had success, but it's a cost too. It's not just, I mean, education is one thing, but I mean, this has to be funded. I mean, this is a whole separate issue. I mean, we have to fund our teachers, we have to fund our education, and people aren't going to be doing it for free. So there's even, I think, steps at the legislative level and things that our system needs outside of healthcare and parents, like by far, even outside of the school system. And you're right, it's an uphill battle. Completely.
But this is great, though, that, you know, it gives you know, everybody who is here today, it gives them a nice starting point and a basic understanding so that we can act as advocates, you know, with our patients and clients if we are given the opportunity. So I thank you for that.
And thank you so much, Danielle, for opening up and sharing your experience. I can't even imagine, you know, those hurdles you go through, but we appreciate you sharing that with the group. Are there questions, comments from anyone? Samantha, I see you unmuted.
Yeah, I was just going to add that in the region I am in, it's almost like schizoaffective in dealing with school systems. There'll be some who are begging for my help and very accepting, and for some reason it's very difficult for the kids to get tested in the schools. I don't know if it's because of a backlog or just too demanding on the schools. So we have been doing testing at our facility, even though we usually lose money on it, because these kids do not get IEPs unless something outside of the school starts the process. And so I've had schools to ask me to do that. And then I've had some that tell me that they are done with IEPs for the year. They're not going to do anymore. So, so like I said, it's almost like,
When you say testing, is that for like learning disabilities and just IQ needs, or are they is that what they're behind in, or?
yeah, so I've been doing the IQ and the achievement. So looking for learning disabilities as well as, you know, whatever illnesses they might have. But yeah, it's just kind of bizarre, and it changes from school to school.
Is that like directly related to like the lack of a school psychologist, you think, or you don't? Is that like a workforce issue, you think, or?
I think it's partly a workforce issue. And I'm wondering if some of the schools the school psychologist is stuck at some of the schools more than others. There's it's so diverse in where the services are and how open they are to getting those services. So maybe the school psychologist is not as welcome at some places as they are at others. I don't know what the issue is.
They're not even getting out of the eligibility at all. They're still stuck in that.
Yeah. Yeah. So what I try to do is do some testing, at least some preliminary things, enough that I can put some information on a piece of paper and send it with the family to the school that says, hey, how about we do an IEP? So I think that's about the best I can do to advocate.
Yeah, that's huge. That's really huge.
Stasia, I saw you unmuted briefly. I didn't know if you had a comment or question. Any other questions or comments from the group? Alrighty, well, thank you all so much for joining today. It's been such a great session with great discussion and everything. And if there are further comments, questions after the session, you're always welcome to email me. And again, thank you, Dr. Swagger, for presenting today. It was, we really appreciate your time and sharing your expertise with us. The only announcement I have is that the next session will be on August 16th. Amanda Newhouse will be talking to us about telehealth tips, tricks, and self-care. Thank you all so much, and we look forward to seeing you all next time. Take care, everyone.
Thank you.
Thank you.